for patients suffering with COPD is that exercise training will improve exercise tolerance and reduce the likelihood of sedentary lifestyle, which leads to muscle mass loss. And oral supplements are given to improve weight gain or exercise endurance. We would recommend the exercise plan and oral supplements to Mr. JN because the exercise would help him improve his tolerance to activity, and the oral supplements would help him improve his weight since he had lost 20 pounds. So the recommended dietary management for Mr. J and first is high calorie. So number one, RMR plus 1.5 stress factor. The rationale for this is Mr. JN is at risk of malnutrition, and second is frequent small meals rather than to 2 to 3 large meals. This may help in reducing the carbon dioxide load and reduces the abdominal discomfort for this dyspnea. So third, do not give high energy feedings more than 250 kcal. It may reduce satiety and reduce energy intake at mealtime. Also, excessive energy intake may increase carbon dioxide and increase respiratory stress. Avoid food that increases gas formation, such as leafy and fruity vegetables, root crops, milk, eggs, and cheese. This will be applied if the bloating is a problem. So fifth, encourage consumption of adequate fluids, and adequate consumption of fluids help prevent the secretion of overly thick overly thick mucus, as fluids helps to the mucus, which makes it easier to cough up. So second is fluid supplements between meals can also help to improve weight gain or exercise endurance, as we have mentioned a while earlier. So six is oxygen supplementation. This is for the patient to eat better. So for second is we recommend Mr. JN to have a high protein diet. So the recommended protein diet for elderly people with COPD is about 1.2 to 1.5 grams per kdBW. This will correct the muscle and tissue wasting caused by the disease. So the reason why bakit kaliit lang ng protein na recommend sa mga people with COPD is because proteins, or let's say yung mga meats or red meats, meats that we usually eat, kasi mahirap sila i-break down sa ating stomach, or mahirapan ang ating body mag-breakdown sa mga bigger or proteins. Mahirapan sila mag-breakdown ng ganun ka-laki na protein. That is why and also din kasi the more din na nag-increase yung abdominal volume, yung body ng patient with COPD, that is also one of the reason why nahihirapan sila maghinga or mahirapan sila magkain, or that is also the reason why makapuyan sila after magkain. So third is we also recommend patient JNs to have a low sodium diet. This is to avoid processed food containing monosodium, glutamate, and salt, and other preservatives. Low salt diet will prevent fluid retention that may interfere with breathing. And then lastly, we also recommend Mr. JN to have a vitamin A, C, and B complex supplementation. We encourage consumption of dark yellow and deep green fruits and vegetables, because vitamin A and C supplementation to support lung function and allow healing and tissues to repair. So we have the fifth. We also recommend Mr. JN to have a hypoallergenic diet. Hypoallergenic foods may be provided to help prevent productions of mucus and itchiness. Hypoallergenic diet and hypersensitivity diet restricts the intake of food that causes allergic and hypersensitivity reactions in different body parts such as the skin, lungs, heart, stomach, and eyes. So that is it for our group's presentation. Thank you for listening po.
Okay, thank you, Ms. Sundungan. Let's go back to the first question. Okay, so may I call on Ms. Takuyan?
Yes po, ma'am.
Okay, good afternoon. Okay, what is the interpretation of your BMI? You get the BMI of your patient? Or, ano na to, degree of nutrition? Hello?
Hello,
I would
ma'am.
like to ask the presenter to open your cam. Okay, I would like to ask the group of Ms. Sundungan to open your cam. Thank you. Okay, let's start with Ms. Takuyan. Ms. Takuyan, did you compute also the BMI?
Wala po ako nag-compute, ma'am, kaysa under items po ako nag-answer. Pero sa interpretation po kay underweight po ang patient.
Okay. Okay, but this is using the BMI formula. Okay, hindi kita makita, Ms. Takuyan. Nagamit pa ko laing device. Hindi kita na makita.
Wait lang po, ma'am.